The Sleepy Historian: Why Your Medieval Barber Was Also Your Surgeon. In the modern world, the idea that your barber might also perform surgery sounds absurd, even horrifying. We expect strict boundaries between professions. Barbers cut hair, surgeons operate, and the overlap is limited to casual conversation in the barber's chair. Yet for much of the medieval period in Europe, this division simply did not exist. The same person who trimmed your beard in the morning might lance your abscess in the afternoon or amputate your leg by evening. To understand why medieval barbers were also surgeons, we must step into a very different medical, social, and intellectual world, one shaped by limited anatomical knowledge, rigid social hierarchies, and a practical approach to healing that prioritized hands-on skill over academic theory. This is the story of the barber-surgeon, a figure both ordinary and unsettling, whose profession reveals much about how medieval people understood the body, disease, and expertise. Medicine in the medieval mind. To grasp why barbers became surgeons, we must first understand how medicine itself was perceived in the Middle Ages. Medieval medicine was heavily influenced by ancient authorities, especially Hippocrates and Galen. Their writings, preserved and expanded upon by Islamic scholars and later translated into Latin, formed the backbone of medical theory in Europe. Central to this worldview was the theory of the four humors: blood, phlegm, yellow bile, and black bile. Health was believed to depend on the balance of these humors, while illness resulted from imbalance. Physicians, those who studied medicine at universities, focused primarily on diagnosing these imbalances and prescribing treatments such as diet changes, herbal remedies, or bloodletting. Their work was intellectual rather than practical. Touching patients, especially performing invasive procedures, was often seen as beneath their social status. This distinction between thinking medicine and doing medicine created a space into which barbers naturally stepped. The social divide: physicians versus surgeons. In medieval Europe, society was deeply hierarchical, and professions were rigidly ranked. University-trained physicians occupied a relatively high social status. They were learned men, fluent in Latin, who consulted ancient texts and offered theoretical guidance. Surgeons, on the other hand, were craftsmen. Their work involved cutting into flesh, dealing with blood, pus, and pain, activities considered manual labor. Surgery was not viewed as a prestigious intellectual discipline. In fact, many physicians considered it a crude and dangerous practice. As a result, surgery developed outside the universities, passed down through apprenticeships rather than formal education. Barbers already belonged to this world of skilled manual labor. They worked with sharp tools, steady hands, and direct contact with the body. From trimming hair and shaving beards, it was a small step, at least conceptually, to lancing boils, pulling teeth, or performing bloodletting. Why barbers specifically? Barbers were uniquely positioned to become surgeons for several reasons. First, they possessed the necessary tools and skills. Razors, knives, and scissors were central to barbering, and these instruments could easily be adapted for medical procedures. Precision, hand-eye coordination, and confidence with sharp blades were already part of the job. Second, barbers were accessible. Unlike physicians, who often served the wealthy elite, barbers worked among the general population. Their shops were common gathering places, especially in towns and cities. When ordinary people needed medical help, particularly for visible, painful, or urgent problems, the barber was nearby. Third, many medical procedures of the time were relatively straightforward, at least by medieval standards. Bloodletting, for example, was one of the most common treatments for a wide range of ailments, from fever to headaches. Since it involved cutting a vein and allowing blood to flow, it naturally fell under the barber's domain. Bloodletting and the barber's pole. Perhaps the most iconic symbol of the barber-surgeon is the barber's pole, with its red and white stripes. This familiar sign traces its origins directly to medieval medical practice. The red stripe represents blood. The white stripe symbolizes bandages. In some interpretations, the pole itself represents the staff that patients gripped during bloodletting to make their veins more prominent. Outside a barber's shop, the pole served as a visual advertisement. Medical services were offered here. Bloodletting was believed to restore balance among the humors. Depending on the illness, different veins might be opened, and the timing of the procedure could even depend on astrology. While we now know that bloodletting was often harmful or ineffective, in the medieval context it was a respected and routine treatment. Barbers became experts in this practice, further solidifying their role as medical practitioners. What did barber surgeons actually do? The range of procedures performed by barber surgeons was broad and, by modern standards, alarming. Their duties included bloodletting, lancing abscesses and boils, extracting teeth, setting broken bones, treating wounds, performing amputations. They often treated injuries sustained in warfare, accidents, or daily labor. In an age of frequent conflict and dangerous working conditions, the demand for such services was constant. Amputations, in particular, were a grim but sometimes necessary intervention. Without antibiotics, infections could spread rapidly, and removing a limb might be the only way to save a patient's life. Speed was crucial. A skilled barber surgeon could complete an amputation in minutes, minimizing blood loss and shock. Pain management was rudimentary. Alcohol, herbal sedatives, or physical restraint were the primary options. Survival depended as much on the surgeon's speed and experience as on the patient's luck. Training through apprenticeship. Unlike physicians, barber surgeons did not attend universities. Instead, they learned their trade through apprenticeships. A young apprentice would live with a master barber surgeon, observing procedures, practicing techniques, and gradually taking on more responsibility. This hands-on training produced practitioners who were often highly skilled, even if they lacked theoretical knowledge. Experience mattered more than education. A barber surgeon who had treated hundreds of wounds or performed dozens of amputations might be far more effective than a physician armed only with books. Over time, barber surgeons formed guilds to regulate their profession, set standards, and protect their economic interests. These guilds also reinforced the separation between surgeons and physicians, even as both groups claimed authority over healing. Tension and rivalry in the medical world. The coexistence of physicians and barber surgeons was not always peaceful. There was frequent tension over professional boundaries and social status. Physicians often looked down on surgeons, accusing them of ignorance or recklessness. Surgeons, in turn, resented physicians for offering diagnoses without performing practical treatment. In some regions, laws attempted to define and limit what barber surgeons could do. Certain complex procedures were reserved for physicians, while others were explicitly assigned to surgeons. Yet in practice, these boundaries were often blurred, especially outside major cities. Patients cared less about professional distinctions than about results. If the barber surgeon could relieve pain, stop bleeding, or treat an injury, that was often enough. The role of the church religion also played a role in shaping medieval medicine. The church generally forbade clergy from shedding blood, which discouraged educated monks and clerics, often among the most literate people, from practicing surgery. This further separated surgical practice from academic medicine and reinforced its association with lay craftsmen like barbers. At the same time, many hospitals were run by religious institutions, providing care for the poor and sick. Barber surgeons frequently worked in these settings, treating patients under challenging conditions. The gradual separation of professions. Over the late medieval and early modern periods, the medical landscape began to change. Advances in anatomy, particularly through dissection, challenged ancient theories. The Renaissance brought renewed interest in direct observation and empirical study. Surgery slowly gained respect as a discipline. Formal training programs emerged, and surgeons began to claim a higher professional status. In England, for example, barber-surgeons were officially organized into the Company of Barber-Surgeons in 1540. Yet even within this organization, tensions remained. Eventually, the professions split. Surgeons separated from barbers, and surgery moved toward scientific medicine. By the 18th and 19th centuries, with the advent of anesthesia, antiseptics, and modern medical education, the idea of the barber surgeon faded into history. Barbers returned to hair and grooming. Surgeons entered operating theaters. The shared past became a curiosity rather than a reality. Life as a patient in the barber's chair. For medieval patients, visiting a barber surgeon was both familiar and frightening. The barber shop was a social space. People gathered to talk, share news, and pass time. Yet behind this everyday atmosphere lay the possibility of pain, blood, and risk. There was little privacy, limited understanding of infection, and no guarantee of success. Still, in a world with few alternatives, the barber surgeon represented hope. He was someone who could do something when illness or injury struck. Survival was never assured, but inaction was often worse. What the barber surgeon tells us about the past. The figure of the medieval barber surgeon reminds us that history is shaped not only by kings, wars, and ideas, but by everyday practices and practical needs. Medicine developed not in a straight line toward progress, but through improvisation, tradition, and adaptation. It also challenges our modern assumptions about expertise. Knowledge does not always flow from books to practice. Sometimes it emerges from hands-on experience, repetition, and necessity. Medieval barber surgeons were not ignorant butchers. They were skilled practitioners working within the limits of their time. Their world was harsher, more dangerous, and far less certain than ours. Yet within that world, they played a vital role. Cutting hair, yes, but also cutting away disease, pain, and sometimes death itself. A final, sleepy thought. So the next time you sit comfortably in a barber's chair, listening to the gentle buzz of clippers and casual conversation, spare a thought for the medieval barber surgeon. In another age, that same chair might have been the site of bloodletting, tooth extraction, or emergency surgery. History, like a whispered bedtime story, reminds us how strange the past can be, and how deeply it shapes the present.